This is your Houston chiropractor, Dr. Gregory Johnson. We have Carlos back with us today for his 8th and final treatment for his acid reflux, hiatal hernia, GERD condition that he's been suffering from for how many years? 3 years?
Probably 3, 4 years.
3, 4 years now. And he's been watching our YouTube videos for about 3 years. And he finally made the decision to come over here from Puerto Rico and get adjusted and get this taken care of. And I'll let you tell him. Let Carlos tell you how it's done for him after we get done with the visit. So this is how we fix that underlying cause of a hiatal hernia. Okay, let's flex you forward and backwards. And I know a lot of you out there are asking, well, is this work really worth my time and money and effort to come all the way to Houston, Texas and get treatment? I'll let Carlos answer that question for you later. And these are all unscripted and unsolicited, so he can tell you exactly whatever he wants to tell you. Okay, Carlos, let's have you go on your back here, and we'll decompress you first. Okay. As you can tell, we're all energized and excited today because we're moving today. After we get done seeing patients, moving our offices over into our new office. There we go, good. Okay, that's it. Yeah, nice deep breath in. There we go. Oh yeah, one more. That's it. That was deeper, wasn't it? That second one?
All the way down.
Yep. Home run. That's what I call my ring dinger. Good job. Okay. Yeah, let me have you completely. Perfect. Yes, sir. Democratic addicts out there gonna be loving that one. A lot of our fans really like to play videos before they go to sleep so they can get relaxed and go to sleep. I didn't know whether to take that positive or negative, if they were boring or they made them feel relaxed. Okay, hopefully they're not boring. Alright, let's go on your phone. So, legs are exactly even now. That's a good start. And they stay even. Is that tighten up anywhere, Carlos? Okay. His pelvis does shift a bit when I do that. So his pelvic bones, the sacroiliac joints, the ilium, and the sacrum, which is called the sacroiliac joint, still needs to be adjusted. There, that's his right ilium. This is left ilium. His sacrum is right in the center, in between the ilii, which is plural for two iliums. There we go. Now we've been getting some really good, deep, solid cavitations down in Carlos's low back and thoracic spine when I do this lateral oblique stretch. I don't know if you can hear those on the video or not, but Carlos will tell you they're clunking right on in there. It may not look like it, but I'm putting quite a bit of pressure in his spine and on his body when I'm doing these. There's L5, there's L4, L3, L2, L1, and now I'm going to put his head forward just a little bit. Now he's had a lot of his issues right here in this lower thoracic spine. There we go. One more here. Yes, sir. Good job. And that's right where the lower rib cage is that the diaphragm attaches to. When the rib cage becomes subluxated or misaligned, where they attach to the vertebrae in the lower thoracic spine, right down in this region, that supplies the attachment for the diaphragm or the dome. The hiatus is right in the center of the diaphragm. If it gets weak, the stomach slips up through the diaphragm and secretes acid into the esophagus, which is where people get acid reflux. So that's why we're treating his thoracic spine and ribs. There we go. Good. Now let's turn you on your back, Carlos. Rather than his hiatal hernia. And I was just reading a study published in the Journal of American Medical Association in December that talked about Prilosec and Prevacid and Nexium and all those PPI inhibitors causing dementia and vitamin B12 deficiency, as well as neurodegenerative changes such as Parkinson's, MS. And you can read it for yourself. It's online if you Google acid reflux, drugs, dementia, and then JAMA. Okay, now I'm going to pull your tummy down here. Carlos, take a deep one. Let all your out. There we go. Now see, his stomach's not nearly as hard today as it was when we started on Monday the first time, and that doesn't hurt as bad either, does it? Okay, another one. But I am still getting in there deep. Grabbing right on the top of the stomach, which is called the fundus, and pulling it straight superior to inferior, down into the lower cavity where it's supposed to be. One more time. Excellent, right there. Okay, good. Let me go ahead and get your knees and your hips while we're here. That's it. There we go. Good. Yep, good job. Okay, Carlos, just turn back on your tummy for 1 second. I do want to stimulate your somatovisceral reflexes again with the turbinator. Pretty good by now. This is his 8th treatment, so his muscles aren't near as tender as they were. Is there any pain whatsoever in your spine when I do this, Carlos? I stay even. That's great. Let's go ahead and set you up and face towards Joseph now. And Renee. There we go. There. Yep. Yes, sir. Good job. Now, see, he relaxes really good for the adjustments, which really helps. When you just breathe and relax and let me do my work, the joints will move through their fullest range of motion, and it won't hurt you. If you fight it, however, then I have to go against your muscles and ligaments, and it may cause some discomfort or pain. So Carlos has been pretty cooperative this week. Carlos, I guess people's biggest question is going to be, well, is it really worth it for me to spend this time, effort, and money to come to Houston, Texas to get this treatment for acid reflux? What would you tell them from your personal experience?
For me, I think it is because, like, if you don't spend the money on the chiropractor, you're going to have to spend a lot more money on doctors and pills. That's never going to work for you, I tell you. And, like, I'm young, and I know a lot of young people. You might be watching this now. I know a lot of young people are suffering with this, and they're recurring to your doctor to give you the pills and all that. They tell you it's not going to work.
Over 50% of the entire population in the world has acid reflux or hiatal hernia. Mm-hmm. That's a big, big population of people, and you're probably one of them. So if you are, don't wait 3 years to come in like Carlos did. Nope. Just call Renee and get an appointment and get on in here.
Exactly.
So this is your Houston chiropractor, Dr. Gregory Johnson, and Carlos, and Renee and Joseph coming to you from Advanced Chiropractic Relief in Houston, Texas. And we'll see you next time.